Hello, I'm Heather Jameson from CHI, and I will be presenting our poster titled High Delivered Dose in a Single Inhalation for Carrier-Based Formulations by Retaining the Carrier Fraction in the DPI Blister. In respiratory medicine, there is a growing demand to deliver higher payloads to the lung. For example, active doses of greater than 5 milligrams. This demand is driven by an increasing number of lower potency molecules for treating conditions beyond asthma and COPD. These higher payloads present significant challenges for the current delivery technology. One challenge is the limitation on emitted mass. The emitted mass from an inhaler is inescapably limited by the cough response of the patient. One approach is to reduce the fill mass by formulating as a carrier-free formulation, although this approach has challenges associated with achieving consistent filling. If your formulation is carrier-based, the traditional approach is to split the total dose across multiple patient inhalations. For example, with a capsule device, the dose can be split across multiple capsules. In this poster, we present a third novel approach. Strip the active fraction from the carrier fraction within the primary packaging and deliver only the active fraction to the patient. Retain the carrier fraction within the primary packaging. This is the approach utilized by Quattrii. Quattrii is a novel blister-based dry powder inhaler developed by CHI. Quattrii detaches the API from the carrier particles and retains the carrier fraction within the blister, delivering only the aerosolized active dose to the lung. This mechanism is known as classification, the separation of different size fractions and the retention of coarse particles. The image on the left shows the formulation as filled in the Quattrii blister. For the purpose of the test, the active fraction has been dyed with brilliant blue food dye. The right image shows the fraction retained in the blister. The blue API particles have been stripped from the carrier fraction and emitted. The coarse carrier particles are retained in the blister. This approach significantly reduces the emitted mass while still delivering the required active dose to the patient. The aim of the study was to evaluate the performance of Quattrii for delivering high payloads of carrier-based formulation to the lung compared to the ultra-high resistance aerosol-1 capsule-based inhaler. In particular, the classification performance of Quattrii was evaluated. The data was acquired using a next-generation impactor, often referred to as an NDI. The test formulation was a spray-dried mannitol API mimic containing around 1.25% brilliant blue food dye. This was blended with lactose, producing a 10% weight-by-weight API mimic blend. The blue food dye enables visible spectrometry to be used to quantify the distribution of the API mimic across the NDI stages and the device. The image shows a micrograph of the test formulation. The aerosol-1 was chosen as a comparison device as it is a widely used inhaler. The ultra-high resistance variant has a similar resistance to Quattrii, allowing NDI stage distribution to be directly compared. Data was collected for an active dose of 6, 8, and 10 milligrams. This corresponds to a total fill mass of 60, 80, and 100 milligrams, including the carrier fraction. For Quattrii, the total fill mass was filled into one 1400 microliter blister. For aerosol-1, 20 milligrams was filled into size 3 capsules, and the total fill mass was split across 3, 4, and 5 capsules. This is to mimic real-world use, as the aerosol-1 emits the entire fill mass, so the fill mass must be limited to avoid cough. let's look at the emitted mass for the 6 mg active dose case. This is the total emitted mass from one evacuation of Quattrii. This is the total evacuated mass from one evacuation of RSO1. However, the dose has been split across 3 capsules, so this is the total emitted mass from 3 evacuations of RSO1. Now let's also include the data from the 8 mg and 10 mg active dose cases. In each case, the emitted mass from one evacuation of Quattrii is on the left, and the RSO1 accumulated emitted mass is on the right. Fine particle dose is shown in light green and is the fraction of the active ingredient with an aerodynamic diameter of less than 5 microns. Let's take a look at where the active mass goes. The pie chart shows the distribution of active mass as a percentage of the total active mass in the blister or capsule. The total active mass is 2 mg for RSO1 and 6, 8 or 10 mg for the tests of Quattrii. The respirable fraction has an aerodynamic diameter of less than 5 microns. For Quattrii, with a gross film mass of 60 to 100 mg, approximately 50% of the filled active mass is respirable. With a gross film mass of only 20 mg, the RSO1 achieves a similar respirable fraction of 55%. To conclude, Quattrii delivers approximately equivalent fine particle dose as RSO1, but delivers the dose in 1 inhalation versus 3 to 5 for RSO1. Quattrii requires the patient to inhale much less emitted mass overall, improving patient comfort and convenience, which may also lead to improved adherence. Thanks for listening. If you have any questions, please come and find us at RDD. We'd be very happy to chat.